So we're going to look here at some common nursing philosophies that exist in nursing. And we're going to talk about how we might care for patients no matter where they live. So here, this is an area of the Appalachian Mountains, which is quite rural, as you can see. They also have a lot of poverty and many socioeconomic and sociopolitical circumstances there. Don't know how much you know about that area now, but in recent years, they have sort of moved from being one of the more prolific areas of coal generation for human consumption, and now actually a couple of their main products that come out of that area are crystal meth and some other illicit kinds of things such as moonshine. So anyway, let's move on and talk a little bit about what theory is. So theory defines different things in nursing, as we talked before. As you look at a theory, what I'd like you to do is to decide if it resonates some insight professionally for you. Does it stimulate some new ideas or ways of thinking for you? And does it provide some new or fresh ideas about how we as nurses care? So moving on, what we all know is that Florence Nightingale was considered one of the first nurse philosophers. Not to say that she was really the only one or the first one, but we know most about her. So nurses recognize healing influences was one of her premises, and healing is a process toward wellness. She also believed that education and training ensure good care and that high morals or ethics were required of nurses. She also felt that nurses were selfless and that for her personally, nursing was a calling. It was the art of healing. And so if you look here, these are some of those attributes that you might potentially consider for your nursing philosophy. So as we move on, the definition of nursing by Florence Nightingale, and we've come a long way since these types of uniforms. I think all of us are glad that we no longer have to wear white. We also are glad that we don't have to wear dresses. I can recall wearing these type of uniform and always wondering if this cap was going to stay on my head because I have fine hair, and inevitably it did not. So what I've done is taken some opportunity here to be a little bit creative, and I have created a Weber blossom. I have some purple petals and some green leaves, and the base of my flower here is Florence Nightingale. And so some of the different pieces of her philosophy include that disease is a reparative process, that nurses enhance healing, they provide a calming effect, that religion influences perceptions, environment matters, which we already talked about related to health of her patients. Moral agents are part of who we are as nurses. You have decisions based on fact. We fulfill human needs and societal needs, and we're serving mankind. And again, the very basis of her flower is nursing is a higher calling. It's a noble profession, and it is nursing is who we are and what we do. So those might be some of your philosophical ideas as well as hers. So moving on, next we have Henderson's ideas about nursing philosophy. And we see here that she believes nurses are independent and that through that independence they provide nursing and medical interventions. And as all of you progress in your DNP education and your role as a nurse practitioner or a public health nurse or a clinical nurse specialist, you will be providing aspects of medical intervention with a holistic approach and a nursing perspective. We also are told by her that there's 14 basic needs, which I'll show you in just a moment, and that education with empathy is required as we care for our patients. So what we find here is that reason, theory, and philosophy really oftentimes are better when two or more people look at ideas and come up with a plan. So here you can see in this image that we have this little tiny fish that's inside this larger fish. So going back to reality and truth, is this picture one that was taken with that little baby fish inside the larger fish, or is this reality that has been changed based on someone's ability to be creative and to use some kind of photo software to edit it to be as they wanted? So the definition of Virginia Henderson and nursing is as follows. Here I've taken the liberty again to create a little graphic of what her model entails, and I actually have built this as a house. We've got a roof and a chimney and a stovepipe here. We have some environmental things inside and outside our house that make us feel good. So Virginia Henderson's knowledge about nursing and her philosophy is that we have development and communication, we have accomplishments, and we have faith and worship. We have other principles such as breathing, food and drink, elimination, hygiene, safety, body temperature, clothing, sleep and rest, and posture that sort of are the basis for our home here. Then we put a little bit of leisure on top and a little bit of play and work here. And then we kind of go through this from the spectrum of wellness to recovery from illness or death. Of course, we don't recover from death, but from illness we have wellness and recovery that happens. And so this is our home that we're forming, and Virginia Henderson has given us some ideas about that. So the next philosophical idea that we want to look at is called the helping art of clinical nursing, and this is Biedenbach's philosophy of nursing. And so her principles include 4 elements. It's philosophy, purpose, practice, and art. And here we have a little bit demonstrating the art of what nurses do. And then we have some key terms that actually become parts of relationships. We have our patient, we have the term of helper or advocate, we have the term knowledge or evidence-based practice, we have nursing action, which are the interventions that we effect for a patient, and then we have certain nursing skills which are technical but also can have some art to them. Some of the things we do are considered an art and not necessarily always the science of nursing. So if we look here at this model, this is my hot air balloon here. This is the basket, and we have Biedenbach in the center. So the bottom of our basket includes patient, and then we as nurses advocate or use judgment. We remember that we are a person and we have skills. And then the things that we're going to look at here are her 4 premises: philosophy, purpose, art, and practice. And out of philosophy comes belief, the idea that life is a gift and that we all have dignity. And out of purpose, she talks about actions, goals, and practices that we as nurses engage in. And then the art of nursing is how we care, how we understand, and what we do with that understanding, and then the utilization of our knowledge from an aesthetical perspective or an aesthetic way of knowing. So taking care of the patients to the best of our ability, using evidence as well as those ways of knowing that each of us have that are unique to ourselves. And then here is practice, and that is where we help patients, we help our interprofessional peers, we address patient needs, and then we, of course, in doing that, will have actions that elicit the interventions that we need to do. And some of those are actual technical skills, some of them are human relationships, some of them are the coordination of care between our interprofessional peers. So now we're going to look at Jean Watson's ideas about nursing philosophy. And she believes that nursing values are unique, that we have a significant knowledge of caring and curing, and that we as nurses have the ideation of healing versus curing, which It's not necessarily good or bad, but promoting health and wellness is what we as nurses do. Most of our caring occurs through human exchanges, and so we have those interpersonal connections. And that academic in curriculums, such as your DNP program that you are enrolled in, allow for you to have a framework of perspective and knowledge. And so here I have created a sunflower, a burst of knowledge. We have Jean at the center, and then she has some different terminology you're welcome to look up if you like, but she has clinical caritas, caring that's transpersonal, and caring moments, and as you know, carita is another word for caring. And then around the center of her flower she has caring consciousness, healing consciousness, the view of self and patience, what we know about caring, and that could be at the baccalaureate, the associate, or the doctorate level, and then the connections that we realize that make a person whole in our professional whole. And then there's some other aspects here which I'll just let you take a look at rather than reading all of them. But they are related to how we care for our patients in some of the ways that we do it. So being authentically present and knowing that care is a trusting relationship. And then the final petals on our flower talk about self, the client, which we still oftentimes call patient, the context of space and time, the context of being authentic and or spiritual in the moment, and looking at physical aspects of care, interactions, once again, and the energy that we exchange between each other. So what I'd like next to do is to let you know that theory of philosophy is a professional knowledge. It's aesthetic ways of knowing. It includes morals and ethics. It's a realm of activity, or the things that we do, and it's based on a belief system. What theory in the category of philosophy attempts to do is to categorize and clarify what it is we do. Again, going back to an art perspective, this is a pointillism image, and if you were to enlarge this, you can see that this image is made up of many, many dots, and each of these dots working together, or each of us as nurse practitioners or DNP leaders or informaticists or clinical nurse specialists, we take all of us together, our knowledge, and put it side by side, and we make this picture of what our patient is going to actually have happen. So reasoning is a pivotal point, and intelligence is something that we're born with. But reasoning, or critical thinking, or diagnostic reasoning, is something that we must learn. And through the program of study, we expect that's something that will happen to you. So you might kind of feel that you're at this crossroads right now, and you're not really sure where you want to go. You don't know what you want to do with your project. You're not sure what your practice is going to look like when you graduate. But as you look closely and try and figure out which lane you're in and which one of these signals is the one that's going to guide you, then you'll be able to find yourself, your personal philosophy, and what that means for you. So the next image, sorry, I clicked on the wrong one. The next image is a little bit about nursing theories and what that might mean for you. So Kathleen Sitzman, a peer of ours who used to work at Weber State, the two of us wrote a book on the history of nurses, and she wrote a little bit more about nursing theories. Nursing theories are creative products of nurses who seek to thoughtfully describe relationships and interactions that exist in our practice. Theory is relevant to the present time and also influences future practice. And what you learned from that little video that you viewed inside Unit B module is that we have 4 paradigms in nursing. We have the person, we have the nursing profession, we have the environment or context of care, and then we have health and wellness. And each of you, as you look at your philosophy, will want to consider some of those things. So I don't know if you remember when you first were in school, but you had to learn a little bit about taking blood pressures and about doing bed baths, your first enema, and as we talked a little bit about your first death and dying talk. I'm going to go ahead and post this so you can look at it, but just know that over time, who you are and what you do as a nurse progresses, and you move I'm sorry, from a novice to expert. So as you look